In just a moment, we're going to see how Kristen is doing, but first, it's my pleasure to introduce you to the doctors who performed this remarkable surgery, Dr. Robert Moore and Dr. John Miklos. And, gentlemen, first of all, fabulous work. I don't think there's a person in the audience and at home watching that wasn't just in amazement watching that procedure. And you have a display here to kind of walk us through visually what happened. You're looking at a cross-section here, almost as though you're looking inside the abdominal cavity, bladder, obviously, rectum here, and in this case, there would not have been a vaginal vault.
Right, so the birth canal doesn't develop. You see that there's nothing here. The bladder and the rectum are touching together. So what we have to do is first separate those two and create a potential space. So this is where, in the past, other things have been put up in here that are very traumatic and can scar and take a long time to heal. However, this procedure actually utilizes the lining of the pelvis, where we then go, and once we open that up, is we actually pull that peritoneum down and suture it down here. And you saw Dr. Miklos suture it up here to create the new top of the canal. And now we have an instant lining with no raw surface tissue that immediately is a fully functional canal. It takes about 6 weeks to heal, and these women do not have to dilate the rest of their lives, and it's very, very successful.
I do have a question. Who's ready to see if Kristen is here and can join us and explain how well she's doing? I know I'm ready to see Kristen. Kristen, come on out and join us.
How are you?
I'm doing great. You know, it's been 3 weeks since my surgery, and I'm feeling great. It's almost as if nothing even happened, which 3 weeks after surgery, I was not expecting that, actually.
Well, that's the mark of a good patient and great surgeon. So
yeah,
that's great.
The first couple days were really rough, and there was, you know, obviously a little bit of healing for the first week or two, but now I feel fine. I feel great. Good for you.
And can I ask the question that I'm sure, Kristen, you've asked of the doctors, which is, you know, functionally now, you have created a birth canal. Obviously, she's still healing.
Sure.
But functionally, what do things look like in the future for her?
Well, I think, first of all, most people see the peritoneum pull down, and they say, well, this is the new layer of tissue. No, actually, her body sees this tissue and then throws down real skin, just like the very beginning of her birth canal, all the way up. In 12 months, if a pathologist would look at this underneath the microscope, he won't know the difference between the whole length and peritoneum, because your body has that regenerative skill in that area.
And use stem cells in this area that transform into normal vaginal lining.
Now, Kristen, so much of what you and I had talked about when we first met was your social and sexual function. Now that you have a new birth canal, what are you most looking forward to?
I'm most looking forward to falling in love, because I've never done that before. And, and I think that now that I don't have this barrier, kind of this wall standing in front of me, I think I can really go from just kind of dating to really allowing myself to fall in love and really be in a committed relationship with somebody.
So
Kristen,
what do you want to...
I can tell you this, there's a lot to love about you.
Yeah.
There really
yes.
is.
Thank you.
What do you want to say to the doctors who you've worked with?
What do I want to say? I don't, you know, gratitude doesn't even begin to cover how I feel for what you guys have done for me. You've really changed my life, and I can never repay you guys for what you've done.
If I could say something, you know, it's no doctor is perfect. Most of us really do try our best to do the right thing, but it's a privilege. And let me tell you, there's not much more of a rewarding surgery than we can do for you. Right. It's something that really tugs at our heartstrings too. I hope that you lead a nice, beautiful, happy life from here on out.
Thank you.